Good afternoon, everyone, and this is a lecture on personality disorders. Personality disorders is a mental health diagnosis, and so let's get started. A person's personality can come from a trait. This can be something you're born with, or it can be something that develops later in life. This is your persona. So these are traits that every person has personality traits, but when they start to become a problem is again when they begin to interfere. They're so rigid. The person is strictly following by their rules. They're not flexible enough to interact with society, so that becomes a problem when developing interpersonal relationships, and it becomes a big problem in keeping occupational functioning, occupational as in keeping employment. And imagine that especially in nursing, us nurses have to be very flexible. Okay, this is someone that is not flexible, and they have maladaptive patterns of their functioning, and that interferes with their life. So I added this poster for you to see. The three types of personality disorders are clustered into three clusters: cluster A, B, and C. I'll go over each one of these, and cluster A is like a group of personality disorders where the person is a little odd or eccentric. Cluster B, the person is dramatic, emotional, or can be erratic. And cluster C, the person is anxious or fearful. So that's how they've grouped these together. This poster is good. It has also the key features at the bottom of each one. Cluster A, social withdrawal, odd or unusual thinking, beliefs or perceptions, eccentric, unconventional behavior. Cluster B is emotional, emotionally unstable, impulsive, attention-seeking, dramatic, intense, or unstable relationships. Cluster C, anxiety, avoidance, rigidity with the rules, not bending. They strictly want to stay within their rules. Okay, so the first one in cluster A is paranoid personality disorder. This is a persistent mistrust. The person does not trust others. They are constantly looking around, very suspicious of others, not trusting. So these can interfere with employment and personal relationships. Very suspicious of others, more common in men than in women. So each one of these I'll describe briefly, and then I'll give you the clinical picture is how this patient will present to you when you're doing your assessment. Constantly on guard, hypervigilant. That's when this person who is hypervigilant is always looking around, always aware, super aware of their environment, ready for any real or imagined threat. And quite often the threats are imagined, they're not even there. Not trusting, misinterprets minute cues. So that's a social thing, that they're missing the cues, that like you're being a little bit odd right now. That person is going to miss those cues in the social environment. Oversensitive, but insensitive to the feelings of others, testing their honesty. Suspicions may have no proof, but they're still having those doubts of loyalty of friends, family, okay, even longtime friends. Intimidating, is very tiring for other people to come up in contact with them a lot. The next cluster A, which again is cluster A, is odd or eccentric behavior. Schizoid personality disorder. Okay, this is a person who is having a tough time having close friends, having close relationships, keeping employment. They are serious about everything. They may be shy and anxious. More frequent in men than women. And they're not responding emotionally to other people in their life. Social withdrawal, no friends. Okay. This may even be, it's not so severe that it may even go undiagnosed. Unless the person goes in for other problems they're having. Schizotypal. This is more odd and eccentric, but doesn't quite get down to the level of schizophrenia. If this person were to if their behavior were to get worse, they may even be diagnosed with schizophrenia. The symptoms are closer to schizophrenia than they are schizoid. Strange thinking, behavior, appearance. They may be isolated, and they're behaving in a bland, apathetic manner, not sympathizing with other people. This is schizotypal, the clinical picture. These are some of the symptoms: magical thinking, ideas of reference. So magical thinking and ideas of reference, these are false beliefs that random or irrelevant occurrences in the world are directly related to them. So, in other words, the newsman on the TV, he is talking directly to me. Or someone on the radio is talking directly at me and no one else. So that would be an example of magical thinking, false beliefs. Believing that telepathy or sixth sense, and believing that others can feel my feelings, and they may also decompensate under stress. They may even become delusional, have delusional thoughts, hallucinations, bizarre behaviors, but of short duration, so they don't occur at a long period of time. Social anxiety, paranoid fears. They seem to be living in their own world. Affect is bland or inappropriate, so your affect is your facial expressions, your body language. That's your affect. Okay. Next under cluster A, odd and eccentric, is antisocial. Sorry, this is cluster B now. Cluster B is dramatic, emotional, and having erratic behaviors. Cluster B, antisocial. Okay, socially irresponsible, not able to function in a social environment. Okay, general disregard for the rights of others. May even exploit others for their own personal gain. Not concerned with obeying the law. Difficulty sustaining consistent employment. Okay, so guess what people are generally antisocial, have antisocial. Where do you think they might end up? Someone who is antisocial. Okay, so someone who is antisocial is there's a very good chance they will end up in jail because they're not able to follow the rules. They don't care about others. They have found there may even be, looking in this person's childhood history, there may be even be a history of physical violence, animal cruelty, aggressiveness, reckless manipulation of others. Okay, so here's the clinical picture for antisocial personality disorder. Not able to keep a job, and that's not good. That's how the person is going to either end up in jail or become homeless. They're not able to keep relationships with others, family, or friends, so the friends may give up on them and then they lose their support. More common in men than women. In the U.S., it's estimated that 3% of the population have antisocial personality disorder. The nursing diagnosis might be risk for other directed violence. Susceptible to behaviors where the individual demonstrates that he or she can be physically, emotionally, and or sexually harmful to others. Next, under cluster B, is borderline personality disorder. Cluster B again is cluster B is dramatic, emotional, erratic behavior. There's 4 of them: antisocial, borderline, histrionic, and narcissistic. Okay, so borderline personality disorder. Patients with this disorder have a very hard time controlling their emotions. They're very emotional. There's some behaviors that are prevalent in this disorder. Splitting. This is the primitive ego defense mechanism that is common in people with borderline personality disorder. They have they never achieved object constancy in childhood. So object constancy is where the baby, you show them a toy, and show them anything, right? Show the baby this. Then you hide it behind their back, and they think the object is gone. They don't understand that the object is still there. So that's object constancy. But that is learned later. With most people, it's learned later on that if I take this and hide it behind my back, well, they look behind you. They know it's back there. They just know you're hiding it temporarily. So someone who lacks this object constancy is not able to understand that even though you love this person, if you don't answer their text or their phone calls, that you still love them. Well, they don't understand that. They have a hard time with that. And so they think that if this person is not answering my call, that they must hate me. And I will totally disregard them from now on since they didn't answer that one phone call. So their relationships are obviously very difficult, fluctuating, changing relationships a lot. They'll go with whatever person will meet their needs, is what they end up doing. More common in women than men. Borderline personality disorder patients are very, very difficult to deal with. I've talked with nurses who are current in psych units, and they'll tell me these are some of the most difficult women are women who have borderline personality disorder. Highly impulsive, low self-esteem, unstable. So with people, they're having negative feelings, or they think you're either all good or all bad. There's nothing in between. So that object constancy allows you to have healthy disagreements with your loved ones and remain close, even if they don't answer your call or reply to your text. With object constancy, you understand that distance doesn't mean they're abandoning you, and that you don't need to see, touch, or sense someone to feel supported by them. So a high feeling of abandonment is very easily felt by these people. There is manipulation in order to get what they want. They will play one individual against another, and they will do it in a treatment center also. They will tell the nurse so-and-so or the social worker is a horrible person, or trying to work one against the other. That's the manipulation. Self-destructive behaviors. So these are the patients who are engaging in cutting. So they'll take a sharp object, cut the arms, forearms, and sometimes the legs, inner thighs. Okay, these can be attention-seeking behaviors. The suicide attempts, they are at risk, high risk for suicide, but sometimes the attempts are coming from a feeling of abandonment and separation from a significant other. The cutting may occur, but there is a measure of safety, so they may swallow pills and then call 911 for help. There's intense mood swings. They view everything in extremes. Everything is either good, or all bad. Here's histrionic, also cluster C. This one is cluster B, dramatic, emotional, erratic, histrionic. So these people are very flamboyant, showing very flamboyant dress, usually in women, lots of makeup, jewelry, attention-seeking behaviors, seductive, very dramatic, overly seductive, using manipulative and exhibitionistic behaviors in order to be the center of attention. They like to be well-liked, but their relationships are typically only superficial. They're on the surface. They have a lot of difficulty with deep, meaningful relationships with others. So highly distractible, flighty, not reliable, provocative, maybe even sexually inappropriate. Somatic complaints are common. So somatic means body, right? Think of soma as body. So these are physical complaints of pain, are common in histrionic personality disorder. Narcissistic. Okay, narcissistic is the last. Cluster B, dramatic, emotional, erratic behaviors. Narcissistic, more common in men than women. You may know people who are narcissists. Exaggerated sense of self-worth. So they want to come off as having a high self-esteem, but in reality, they have a very low self-esteem, and they're really hard on themselves. They don't understand that their behavior is inappropriate. They view themselves as superior beings. It's almost like it's their way of surviving because of the low self-esteem. They have to exaggerate their feelings toward themselves. Self-centered, not feeling anything for anyone else or empathy for anyone else. Criticism is going to cause them to go into a rage sometimes. Strongly independent. Okay. Mood swings. Okay. Very fragile self-esteem. Moods can change quickly. Will exploit others to meet their own needs. And avoidant is the first one in cluster C. Cluster C is anxious and fearful are the main personalities, the main symptoms. So the first one is avoidant. Avoidant, just think of the word avoidant, avoiding people. Doesn't like to be around people. Socially withdraws from others. Not a lot of friends. Not a lot of support people that hang around them. Avoid social situations. They want to have close relationships, but they're afraid of being rejected, so they just don't bother with social relationships. Lonely, feeling unwanted, sensitive to rejection, shy, looking for acceptance, awkward, uncomfortable in social situations, timid, cold and strange, withdrawn. Close relationships may soon learn about their sensitivities and mistrustful qualities. Speech is slow and constrained, hesitations, occasionally confused. Again, low self-esteem, avoid social relationships for the fear of rejection. Dependent personality is the next one in cluster C. Lack of self-confidence. So this person, just think of the word dependent. This person becomes dependent on others for everything. Transportation, financial needs, housing. So you can imagine this person probably remains very dependent on their parents. Afraid to go out and do anything. Afraid to go out and get a job. More common in the younger children of the family. More common in women than men, relying on others for emotional and all other types of support. Afraid to take any, if they do have a job, they're afraid to take on any leadership roles. Afraid that they're not going to be able to take care of themselves. Relies on others for everything. Decision making, physical needs, and self-worth. They are focused on pleasing others. Okay, more on dependent personality disorders, low self-worth, easily hurt, and avoids positions of responsibility. So they're not going to apply for any leadership roles in their job. They would rather assume a passive role in relationships. Lack of self-confidence, even in their posture, voice, and mannerisms. Obsessive-compulsive personality disorder, also in cluster C. Inflexible about the way things must be done, serious, mannerisms, difficulty expressing emotions, over-disciplined, perfectionist, preoccupied with rules, inflexible. So imagine how this person will have difficulty keeping a job if they're constantly rigid and does not want to bend any rules. More often in men than women. Most common in the oldest children. Socially polite and formal, but underneath they're ambivalent of others and having conflict and hostility with others. inflexible, anxious, rule followers, perfectionists, difficulty time forming relationships with others. Okay, so this is different than OCD, anxiety. The anxiety disorder is different because they have in this one, obsessive compulsive personality disorder, the recurrent obsessions and compulsions are not happening in this one. If they do present with the obsessions and compulsions, the hand washing, touching, checking, if they end up presenting those symptoms, they may be later on diagnosed with obsessive compulsive disorder. They are inflexible, work diligently, meticulous, okay, but concerned with matters of organization and efficiency, rigid, unbending of the rules and procedures. These are some of the nursing diagnoses for borderline and antisocial. Okay, especially borderline, risk for self-mutilation, okay, with the cutting. Complicated grieving, I would read up on that because I have seen many test questions on the standardized testing that are addressing complicated grieving, and I will cover the chapter on depression, and that goes into a little bit about complicated grieving. And antisocial, risk for other directed violence because they can become violent and aggressive with other people. And these are the therapies. They're the dialectical behavior therapy is used for borderline, for example, for borderline personality disorder. It helps them to learn how to manage their emotions and improve their relationships. That's the goal that they have in the dialectical behavior therapy. This follows the belief that the primary problem is emotional dysregulation, the emotional reaction to perceived threats. The dialectical behavior therapy helps patients to acknowledge that two people can have opposing views, yet both have valid, partially true perceptions. So in other words, it's okay for people to disagree. Okay, it's not the end of the world. Two people can have two different views and you can still be friends and still have a relationship with that person. So that's how therapy helps. The psychopharmacology, a lot of times, again, are anxiolytics, benzodiazepines for anxiety. The buspirone, I'll talk about when I get to pharmacology. The chlorodiazepide, which is Librium, I talked about in another lecture. Those are the typical, and also antidepressants, okay, may be used for these personality disorders. And that's all I'm going to cover today, and I didn't want to go on too far. So if you're enjoying these lectures, please like, subscribe, and share. My YouTube channel is Nursing with Hart, PhD, H-A-R-T. All right, have a great day.